লিঙ্কটা রাহুল স্যারের শেয়ার করুন।
Everyone is hearing me. Welcome everyone to this live session. Actually, we are waiting for the audience, taking some times to create some audience, and Sar is here. Sar is also waiting for the new audience. So as soon as possible, join here to join this live session with our charismatic mentor, Dr. Sumanta Saha sir. And once again, we are welcoming everyone. Thank you so much for your patience waiting. I hope everyone will enjoy this session.
সাউন্ড ঠিক আছে? হ্যাঁ, এবার ঠিক আছে। সাউন্ড ঠিক আছে? হ্যাঁ, এবার ঠিক আছে। So making this program to be more successful, and I'd like to have a very good planning actually to come up here at least once a week. Program to be more successful. So actually, this type of program, doing this type of program is really difficult for me because I have so many busy schedules. But yes, I'm very much devoted and dedicated to make all the doctors to get the full preparations with the best possible way in a always smartest way. And definitely, my dear, preparing any exams is not only just reading the materials and recall something and going for the exams and answering questions with confusions. Yes, this is not the way, my dear. So I'm just waiting to get some more audiences to be here, but I think we should start now, right? Yes, we should start. So let's start the session here. Yes. Yes, তুমি রেকর্ডিং শুরু করতে পারো বিজয়। নতুন করে না, নতুন করে, it will be different. Hello, my dear doctors. Welcome to this session. The topic that I picked up, very important topic for the exam like the MRCP Part 1 and definitely for the Part 2 written for the United Kingdom exams and also for Ireland exams. MRCP UK for Part 1 and Part 2 exams and MRCP Ireland for Part 1 and Part 2 written exams are very similar to prepare yourself the best possible. But the things are really different that how to focus into the different topics. In Part 1 preparations for the Ireland and UK, that you need to focus the same topic, but in Part 2 in preparation, yes, with the same topic, but with more deeper knowledge, more twisting, more complexes, more differential diagnosis, more important things that you need to know to differentiate in between the two different diseases, my dear, so that you can remove yourself from the confusions to get the answers correctly with confidence. So yes, my dear doctor, these are very important sessions that we are going to do now. I picked up the important questions from Part 1 and Part 2 written different past paper, but we are gathering for the single topic like the amyloidosis. Why I have done this one? Rather than going through the random questions from the different systems, different chapters, different past papers, my dear, listen very carefully. Learning in a different ways is not the outstanding performances that you can do in your exams, rather than learning with the proper, effective, and fruitful way that will lead you to more than 100% success rate. I always talk since 2009 that I have been teaching for the MRCP in all over the world, more than 170 countries. So definitely the learning method that I know that is more than standard, my dear. So yes, my doctor, that's why I picked up the important questions from the different papers from the last 10 years. I picked up the different questions here so that you can go through them from the single topic. Like I have picked up the topic like the amyloidosis. That will be the best learning experiences that we had earlier, my dear. So let me start by question scenario first. Just focus on to my board, my dear. So yes, this is the first question that I picked up. This is a very important question, and definitely in each and every diet, this question are hitting in every diet for the MRCP Part 1 and also the Part 2 written exams, my dear. In Part 1, there is usually no photography is given, but in Part 2 written, there is photography is given, my dear. So my dear, listen very carefully. Now let me start by the question number 1, like the 41-year-old man, yes, who has received a long-term hemodialysis. So I have some of the picked up the important keywords here. The long-term hemodialysis for chronic kidney disease due to type 1 diabetes. So he has a chronic kidney disease, yes, and this gentleman is suffering with the type 1 diabetes, yes, my dear. And presents for the review. He has been suffering from the pain and tingling in both hands, which particularly comes on during the early hours of the morning. He has also noticed shoulder pain over the past. So start with the shoulder pain. Yes, pain and tingling in the both hands. This is important. And over the past few days and few months, he's on dialysis. Use conventional, yes, so conventional cellulose acetate dialysis management. This is one of the important keywords that you need to pick up. So my listen, only physical examination, there is no structural deformity in the hands, but extra of the both hands is ordered, and it showed that destructive arthropathy with periarticular cystic bone radiolucences. So why did doctor listen very carefully? This is very much important that you read the scenarios and you get back which of the following diagnosis fits best with this clinical picture. The answer options are the uremic neuropathy, diabetic nephropathy, AA amyloidosis, AL amyloidosis, and beta-2 microglobulin amyloidosis. If I throw these questions to all of you guys, so what would be the best answer? I request everyone to put your answers there. Stop. তোমার কাজ হবে শুধু খালি পরে জোড়া লাগানো, বুঝছো তো? আর অডিয়েন্সরা কি করছে একটু জানতে চাই। I would like to know what audience is doing. So I'm requesting, এখন কোনো রেকর্ড করবে না তুমি, আমি বললে রেকর্ড করবা, yes. So I'd like to request everyone to put your answers here for these questions, my dear. The question number 1. After that, I'd like to discuss. আমি একটু কৌশিককে রাখতে যাচ্ছিলাম। দিছো, ঠিক আছে, আমি একটু কৌশিক, আমি যেটা চাচ্ছিলাম the most likely diagnosis. What will be the most likely diagnosis in this scenario? কৌশিক, আমি যেটা চাচ্ছি, আমি যেটা দেখছিলাম যে মানে সাইট দিয়ে তোমার ইউটিউবে সবাই আনসার করতে থাকে।
জি স্যার।
তো এখানে তো
এইখানেই স্যার আনসারগুলো আসে।
সে ফর এক্সাম্পল আমি দিলাম,
এভাবেই আসে স্যার বিষয়গুলো।
So I'm requesting everyone to put your answers here so that the discussions will be very, very helpful. কতজন অডিয়েন্স আছে? এটা আমাদেরকে ফ্রিকোয়েন্টলি করতে হবে, তাহলে আরো বেশি পাওয়ার।
স্যার 16 জন দেখতেছে।
He is the answer, এখানে লিখছে, আচ্ছা
16 জন আছে স্যার। হ্যাঁ।
I expect more people should, yes, should participate here. Put your answer here. I will go for discussions later on. Now, কি ফেসবুকে শেয়ার করা হচ্ছে?
জি স্যার।
কই ফেসবুকে তো নাই। ওই ফেসবুকে শেয়ার করা হচ্ছে।
স্যার হোয়াটসঅ্যাপে বলা হয়েছে তো দেয় নাই, আমি আবার পাঠাইছি। হ্যাঁ এখন ঠিক আছে।
Yes, I see that Dr. Fahim break the ICU barrier. He has put the right answer. Is the answer. I'll discuss what will be the best answer and why, and very good discussions will be going on because this is one of the important questions, and also not for the exam like the MRCP, any exams for your whole life, any clinical practice that will be really helpful for all of you guys all together.
এখানে ঠিক আছে। জি স্যার।
ছিল 16 জন ছিল।
স্যার শুরু করতেছি কন্ট্রোল রেখা।
ওকে ফাইন।
স্যার অডিয়েন্স আছে, শেয়ার হচ্ছে আপনার।
তাহলে এটার ফরম্যাটটা একটু জেনে রাখা, আমরা যদি এরকম করি যেন এই যন্ত্রণা না হয় আর কি।
জি স্যার অবশ্যই স্যার, প্রথমবার তো ঠিক আছে।
আমি যদি এখন এটা থেকে কোনো শেয়ার করার অপশন আছে, মানে কম্পিউটার জাতীয়, তাই তো আসবে?
হ্যাঁ হ্যাঁ, ওইটা আমরা বলে দিচ্ছি, আপনার কোনো কিছু করতে হবে না।
তার জন্য বোর্ডে যাই,
আপনি যেখানে যাবেন সব সব অটোমেটিক হবে।
এখন
লাইভ জুম ক্লাসের মতো আপনি যেভাবে মুভ করুন সব সব দেখবেন।
হবে। এরপর আমি একটু বোর্ডে যাবো, তুমি থাকবে এখানে, এদিকে থাকবে। Yes, my dear doctor, so I'd like to go now the discussions. Now, Joy, you can talk. I'd like to go the discussions now. This is very much important. So yes, my dear doctor, here once again, actually my tips and tricks is really important to cleanse the diet. Oh, you stop. Yes, my dear doctor. Now let's discuss some of the discussions. What is the best answers here? So yes, many of them giving so many answers like the uremic neuropathy, diabetic nephropathy, AA amyloidosis, AL amyloidosis, and beta-2 microglobulin amyloidosis. My dear doctor, listen very carefully. It's a questions for the amyloidosis. So it's important keywords that I picked up: the long-term hemodialysis, CKD, type 1 diabetes, pain and tingling in the both hands, conventional cellulose acetase dialysis membrane, and destructive arthropathy with periarticular cystic bone granulocytosis. So what will be the diagnosis? So yes, my dear doctor, I'd like to discuss first regarding the best diagnosis, then coming back to this scenario so that you can understand the things really better. So let's discuss. Yes, my dear doctor. So yes, my dear doctor, you can see the best answer here, definitely the beta-2 microglobulin amyloidosis. I'll go through a little bit discussions here, and after that I'll have a very board lecture slide. I'll give some of the boxes that is SS box is very much helpful for whole life, my dear. So come back here. The conventional dialysis membrane cannot clear the substances with molecular weights of the more than 200 daltons. This is important. So once again, the conventional dialysis membrane cannot clear the substance with the molecular weights like more than 200 daltons. These allow accumulation of the beta-2 or beta-2 microglobulin, and which has a molecular weight of, you see, this is 11,800 daltons. A normal functioning kidney would filter this in the glomerulus, and it is catalyzed in the proximal, yes, tubule. In some, patients are dialyzed for more than 5 years on a conventional dialysis membrane. Accumulation of the beta-2 microglobulin amyloid leads to the carpal tunnel syndrome, tenosynovitis, and scapulohumeral arthropathy, and bony cyst, and even pathological fractures. So GI and cardiovascular manifestations may occur. The mainstays of the management are moving towards a Yes, the mainstays of the management are moving towards a polyacryl nitrile. So I say the cryl nitrile or polysulfone dialysis membrane, which are higher flux and allow the beta-2 microglobulin to be removed or moving to the transplant. This is important if a kidney is available. Other forms of the renal amyloidosis occur in association with the other systemic inflammation, such as in the rheumatoid arthritis, hematological malignancies, such as myeloma. Aggressive use of secondary agents may slow the deposition of the amyloid in inflammatory conditions, as may chemotherapy in conditions such as myeloma. So, my dear doctor, it's very important. I'd like to discuss board discussions, and of course, the SS box is fast before moving back once again. Yes, give me the board. So this is a very important SS boxes that I'd like to share with all of you guys here. This is very much important, my dear, for these discussions. So this is a very specific things that you need to learn, my dear. There is the beta-2 microglobulin amyloidosis. I'll discuss later on with other question scenarios with the amyloidosis, but now I'm just very specifically beta-2 microglobulin amyloidosis, my dear. Yes. So it's a board discussion that I'd like to do. This is very much important. It says that we need to know one of the important things, the conventional dialysis membrane. Conventional dialysis membrane are nothing but, yes, my dear, this is cellulose I'm writing. Conventional dialysis membrane is the cellulose. Just let's get by heart. So these are the C-minor. Conventional dialysis membrane is nothing but the cellulose membrane, and that cannot pass. This is very much important. The molecular weight is more than 200 daltons. Yes. Substances. Means conventional dialysis membrane cannot clear the molecules which are the bigger size. Means more than 200 daltons. That remember, my dear. So that leads to ultimately beta-2 microglobulin. Beta-2 microglobulin to be deposited, because these beta-2 microglobulin, which is usually catalyzed in the proximal tubule, which has the molecular weight more than 11,800 daltons. Yes, my dear. Just feel it. So conventional dialysis membrane is a cellulose which cannot actually pass and clear more than 200 daltons. So beta-2 micro is normally in our body, which has the normally produced in our body. So yes, this beta-2 microglobulin is more than 11,000. So how can it will be passed? So ultimately, beta-2 microglobulin is deposited, and that goes to the different tissues, and they are damaging the different organs. Especially they go to the different structures, especially amyloid, this beta-2 microglobulin amyloid compressing the carpal tunnel, means the median nerve, that leads to the carpal tunnel syndrome, my dear. So I'm writing the carpal tunnel syndrome. Yes. And also they are going to the tenosynovitis. I'm writing the synovitis. Just write with me. And also they are going to the scapulohumeral arthropathy. So I'm writing the scapulohumeral arthropathy. Scapulohumeral arthropathy means the scapulo. Yes. And most importantly, yes, the bony cyst. That's important. Cyst. I'm writing the cyst. Bone or bony cyst. Yes, my dear. And this leads to the fractures. I'm writing the crush. The crush means the pathological fracture. Means the fracture that in the terms of the fractures that I'm writing the crush, my dear. Yes. Yes, this is important. So, my dear doctor, listen very carefully. So, these are the symptoms, and very rarely the other syndromes like the GIT and other cardiovascular syndromes can occur. But these are the most common manifestation or syndromes that occur, my dear. So, yes, as I said, this is important. You can remember this one. The conventional dialysis membrane is made of cellulose and that cannot pass the beta microglobulin, and that leads to the beta microglobulinemia. Means this beta microglobulin deposition that leads to the damaging the carpal tunnel, that leads to the carpal tunnel syndrome, synovitis, and capillohumeral arthropathy. And second to the cyst, and that is the crust and pathological fracture, that I say the cyst and crust. So if you say with me CTS, synovitis, capillohumeral, and also the cyst and crust means the pathological fracture. If you remember these important features, yes, these outcome of these beta-2 microglobulinemia. So in that SS box, if you know them very well, so you can apply these knowledge into the scenarios, then you can give the right answers, calculate confident, my dear. So yes, my dear doctor, so it is said that what will be the management? Management would be, yes, not to use the conventional cellulose membrane, rather than it is said that we need to move to, this is said that the polyacryl nitrile. So I'm writing the cryl, yes, my dear. Polyacryl, I say the cryl nitrile. So this is nothing but the poly A. Yes, my dear. So cryl nitrile. Use of cryl nitrile, yes, membrane in dialysate would be the better options in this beta-2 microglobulinemia, my dear. So once again, if you just think about, yes, the conventional is a cellulose that leads to the beta-2 microglobulinemia, and that leads to the carpal tunnel syndrome, synovitis, means the tenosynovitis, if you remember. And once again, if you think about the capillohumeral or scapulohumeral arthropathy, and ultimately they are distracting the bones, and that leads to the cyst in the bones, and cyst is going to the fractures, and then I say the crush. So these are the important syndromes usually happen in beta-2 microglobulinemia. And what will the management plan? Not to use the cellulose, rather than you use the cryl nitrile, means the polyacryl nitrile membrane, rather than the conventional cellulose membrane. Or you should move for the transplant list. The patient should be put onto the transplant list, my dear. And it's said that these kind of beta-2 microglobulinemia is the long-term hemodialysis, my dear. Long-term hemodialysis or long-term dialysis that leads to the beta-2 microglobulinemia. In the scenario, if you get the long-term dialysis, long-term dialysis that leads to this kind of syndrome, so you should put the diagnosis, the most likely diagnosis, the beta-2 microglobulinemia. Yes, my dear doctor, listen very carefully. In part 1 exam, maybe only a scenario that will be 52-year-old gentleman, type 1 or type 2 diabetes, own CKD or ESRD. They are going for the dialysis, and they have some of the features like the CTS or only carpal tunnel syndrome or any forms. Single line answers in part 1 will be happen, and just put the diagnosis beta-2 microglobulinemia. But on the other hand, in part 2 it will be more complex questions. They will have the big scenarios, but once again the similar things. The question scenario will focus on that the gentleman has been for the long period of dialysis, and these things are really important for the part 2 written. That is the cellulose membrane, and of course now what will be the management? The cryl nitrate, means the polyacryl nitrile membrane should be used, my dear, for this management, my dear, for the beta-2 microglobulinemia preventions or further consequences, and maybe the renal transplant, maybe that would be the other option. I hope that, my dear, going through these questions and scenarios, you're enjoying. Stop করো তোমার recording. And I'm stopping now. Yes. Not enough. The video is so poor quality, sir. বলছি অনেকে।
কমেন্টগুলো নিয়ে আমরা দেখব।
Okay, my dear doctors, sorry for that. Some of the technical issues, maybe the outside environment is not good, the cloudy environment. Outside is raining, maybe some reasons for the internet connection, some technical issues. So maybe later on we'll be seen once again. Yes, in this platform. I think that this platform will be really, really helpful for all the guys who are preparing themselves for the MRCP exams, like the part 1, part 2 written for the UK and Ireland exams, my dear. So yes, move forward for your next time. Yes, we'll see you the next time, my dear. So we are stopping here today. Thank you very much. দাও, স্টপ করে দাও। তোমরা টেকনিক্যালি কি করলা বুঝলাম না কিছু। এটা খুব হেল্পফুল হবে।